Dr. Hilda, you are welcome to Health Check today.
Thank you.
So today, as we said earlier, we're speaking about jaundice in children. Please tell us what exactly jaundice is.
Okay, so jaundice is a symptom rather than a disease.
Okay.
So symptom meaning that it's just evidence or something to show that there's a problem going on, not really like a diagnosis per se. And when you say jaundice, simply put, it means that there's yellowing of the skin and the yellowing of the eyes, the white part of the eye in anybody. So that's jaundice, and often it's because there's a problem with the liver, or there's some excessive breakdown of red blood cells, or probably because there's a blockage in the biliary system.
I heard that word when I was looking it up. So are there like levels or different types of jaundice, or is there one type, or how does it work?
When we talk about jaundice and you're looking at the causes, it may be because there's a problem with the liver itself. So we'll say hepatocellular, like there's damage with the liver itself. It could also be because there's an obstruction in the biliary system. So like the bowel system helps us in digestion of fats and oils. And it may also be because there's excessive breakdown of red blood cells. This excessive breakdown of red blood cells may cause what we call bilirubin. So there will be high levels of bilirubin in the blood, and this will cause the person to show the yellowing color of the eyes and then of the skin that we see in jaundice.
Okay, so it might sound like I don't know, it might sound as like a silly question, but how can you see yellowing in the skin on black children?
Often what you will find is the eyes will become yellow. So the eyes become yellow. The white part of the eye we know is expected to be white, but it becomes yellow, and that one nobody will miss it.
Okay.
When it's like that, the skin also becomes yellow. So you see a hue which is not normal, and that will point to you that there's something going on which is abnormal, and tying in with the eye, even if you're a lay person, then you can conclude that the skin is also yellow, or the color of the skin has changed and it's not normal anymore.
Okay. So I'm a parent. I've had a newborn, and I've seen in the newborn that there's a yellowing of the eyes. Now I'm starting to see also that the skin has a yellow hue to it, as you were saying. It's been maybe some 2 to 3 days. Does that make it an emergency, or does it have to be a bit longer, or what happens?
So there's something we call jaundice in the newborn, or newborn jaundice, neonatal jaundice. What that means really is that the child or the baby who has been born has yellowish discoloration of the eyes again, and the skin. The skin may not have been noticed, but often the eyes are noticed, and the person is less than a month of life or 28 days of life. So that is newborn jaundice. Looking at newborn jaundice, it can occur on any day in the life of the baby who is less than the 28 days. But if it occurs within 24 hours of life of the baby, then we call it pathological, meaning that the cause is something that we really need to look into and find and treat where possible. Okay, so 24 hours of life, a baby with jaundice is pathological, it's not normal, and so we need to investigate further. If the jaundice occurs in this baby after the first day of life, that is from the second day onwards, then it may be as a result of what we call physiological jaundice. This is expected because the baby's liver is not very matured, and so it's not really able to handle the load that is given it. Also, it may be because the red blood cells are breaking down frequently, or earlier than expected, and that is why you may have the baby becoming jaundice. Often we are not alarmed about that one, and it will go away in a few days without much or any intervention at all. Now, there are other causes of the jaundice in the newborn. So we look at things like infections. If the baby is having any infection of any form, it can cause the red blood cells to break down frequently or earlier than it's supposed to be and cause the baby to become jaundice. Aside the infections, we have things like differences in the blood group of the mother and the baby. So there's this thing called ABO incompatibility. So you have the mother having blood group O and the baby having blood group A or blood group B.
Wow.
The differences in the blood group could cause the baby's red blood cells to break down and cause the baby to become yellow. Aside that, we have what we call rhesus incompatibility. So in that one, you have the mother, let's say mother is blood group A negative. So mother is rhesus negative and baby is rhesus positive because of the baby's father being rhesus positive. So the differences in the blood group of the mother and the baby, that's the rhesus, mother being rhesus negative and baby being rhesus positive, can cause that reaction and cause baby's red blood cells to break very rapidly and cause the baby to become jaundiced. Babies who are born premature are also more likely to become jaundiced than babies who are born after 9 months of pregnancy. There's another thing that we call G6PD deficiency. So in people with G6PD deficiency, they lack sufficient quantities of an enzyme that we call the G6PD. So they are deficient in the G6PD enzyme. And this G6PD enzyme helps to maintain the toughness or the integrity of the red blood cell. So it helps to prevent the red blood cell from breaking down quickly.
Is that common?
Fairly common. So there are some people who have it and may not even know that they have the G6PD deficiency, but often they may see the jaundice when they encounter, maybe they eat fava beans. Ghana, we don't really eat fava beans, but in the supermarkets now you may see fava beans. And also if they take some medications, so the sulfur medications and some other medications, if they take them, it may cause their red blood cells to break down quickly and then cause them to become jaundice. Other things like obstruction to bowel flow may cause the baby to become jaundice. If there's a problem with the liver, hepatitis, the hepatitis A, B, C, all those can cause the person to also become jaundiced. And then if there's also liver cancer, but those are commonly for older children, the hepatitis A especially also usually for older children, but the B and C can occur in the babies as well. So commonly these are some of the things that will cause the baby to become jaundiced. If you are breaking it down further, then we have the type that can cause damage to the liver, okay, and then we have the type that can cause damage to the brain. The type that can cause damage to the brain, if it is spotted and we do not intervene, and it goes on and on and on, and the levels of the bilirubin rise high enough, it can cross into the brain and cause damage to the brain.
Wow.
That we call bilirubin encephalopathy.
The names, yeah. But is jaundice hereditary? Can it be hereditary?
So depending on the cause, so if it's maybe because the person has a metabolic condition or something like that, then yes, you can say that. But in the newborns especially, it is something that we expect, because for the newborn babies, we know the physiological, if you take babies who are born after about 9 months, we know that about 5 to 6 out of 10 of them will become yellow in the first week of life. If you are taking premature babies, then about 8 out of 10 of them are likely to become jaundice or have the yellow in the first week of life. So it's something that is fairly common. And the thing too is that whether it is the one that can cause damage to the brain or the one that can cause damage to the liver, we need to spot it early so that whatever interventions that we need to make, we can make them before it becomes too late. For the one that can cause brain damage, for some of them the levels can rise very rapidly, such that if you are not careful, even by the 3rd day, if the baby is not seen and the interventions made, it would already have gone to the brain. And the one that can cause damage to the liver can, so if by 3 months or so the surgery that is needed to save the person's life is not done, it can cause damage to the liver, which is irreversible and will require a liver transplant. So it's important that whatever it is, if you notice that your baby's eyes are yellow in the first few days of life, you bring the baby to hospital. And most importantly, you need to look out for it because it's likely to happen. So you have to look out for it.
Okay. So I think from what you're saying, it's quite a common something, and it shouldn't be something we are worried about, but we should pay attention to it.
Yes. For
Okay.
older children, I left out one important cause: sickle cell disease. You know, children with sickle cell disease may have their red blood cells also breaking down frequently because of the sickling that they have in the red blood cells. So they may also have jaundice commonly. All in all, jaundice is not something that should scare you, but it is something that should prompt you that you need to see your doctor so that the necessary tests are done and the necessary treatment is initiated.
Now, I was also told that if you also take the child into sunlight, it will help jaundice either not to occur or to bring it down. Is that right, or is it an old wives' tale? Or
for the sunbathing, we do not encourage it anymore. In the past, it's been used, but currently we do not recommend sunbathing because the sun also contains harmful rays, which can harm the skin of the baby, the eyes of the baby, even the genitals of the baby. So if a baby has jaundice, the recommendation is no longer sunlight. We will say that do not keep the baby indoors without any light coming in or anything. Make sure that your baby is in the open so that you can see. The baby should not be hidden. Okay. The window should be open. There should be some light so that it will even help you to appreciate if there's any color change within the first few days of life. So no more sunbathing. We don't recommend it anymore.
Okay. Please.
It's okay.
So what would you recommend?
So, okay. Depending on the kind of jaundice that the person has. So if the baby has the kind of jaundice that can go to the brain and cause brain damage, then the treatment that we'll do is phototherapy. That is light therapy. If the levels of the jaundice are not too high, then we'll start with that one. If the levels of the jaundice are very high, such that we even suspect that brain damage has begun already, then we may recommend what we call an exchange blood transfusion, where you take out part of the baby's blood and replace with fresh blood. So you exchange the person's blood with fresh blood. So that's the exchange blood transfusion. Even for those, because we may not get the blood coming in immediately, we may start with the phototherapy, which is a light treatment, and once the blood comes in, we do the exchange blood transfusion. If, however, the person comes in too late with the baby and the damage is so severe that we don't think the baby is well enough to be able to withstand the procedure of the exchange blood transfusion, then in that case, we will do the phototherapy even though the levels are very high, and not do the exchange blood transfusion.
Okay. So yes. Not every child that can take that, depending on how sick the child is.
So if the child is or the baby is too sick, then we will not do the exchange blood transfusion. But if the baby comes in and there's brain damage, we see signs of brain damage and the baby can withstand it, then we'll do the exchange blood transfusion. After that, we'll put under the light, and then the phototherapy will continue with the treatment that we want.
Okay. So going back to the photolight therapy that you mentioned, I mean, somebody may also say that, well, you're doing the light in the hospital, so let me do my own light in the house, or like they said, go. Why would you say that this is more beneficial to the child or to the baby?
When the babies come in, it's not just saying that we are doing light treatment. So you see, I mentioned that there are different types. As the person is at home, as in the caregiver, how will the caregiver know that this is not the type that does not require phototherapy? And for the other type that does not require phototherapy, the one that will affect the liver, the one that can cause the liver damage, well, if it's biliary atresia, then there's a surgical procedure that we need to do before age 3 months. We call it the Kasai procedure. So all this needs to be assessed in hospital. So as the baby has come in, we are qualified and will be able to take the history, examine the baby, and come up with a diagnosis and a treatment plan based on the investigation results. So all this cannot be done at home. Also, even in hospital, we keep checking what the levels of the jaundice are, or what the levels of the bilirubin are. If we find that the level is rising too rapidly in spite of being under the light, we may still say that we need to do an exchange blood transfusion or something. You see, so it's not just about I can provide the light at home. And that is also one of the reasons why the sunbathing is dangerous. Because as the people are doing the sunbathing at home, they are there alone on their own doing their sunbathing. Nobody is monitoring anything. By the time they bring the babies to hospital, the babies are not feeding anymore, they are not crying well anymore, and may even have started having convulsions or so at home. You see, and by the time they come in, then it would have been too late. We can't reverse the brain damage that the baby would have had as a result of the jaundice or the bilirubin crossing into the brain. And that is really why we say that no sunbathing. If you have a baby, look out for jaundice in the first few days of life. If you find it, send the baby to hospital, report, and let us do our assessment. If we find that the levels are not high enough or are not worrying, we can say go home, maybe come back in 2 days or so, and let's reassess the baby, rather than keeping the baby at home and doing your own thing. My grandmother said this, somebody said I should put glucose water on the eye, somebody said I should do this or that. All those things, we don't do them anymore. Yeah. So if you notice anything abnormal with your baby in the first few days of life, come to hospital. That is why we are here, really.
Okay. Dr. Hildeboy, thank you so much. I think you've allayed a lot of fears, and I think the old wives' tales have been pushed out, and then you've given some thorough medical information so that people can be aware as to what to do and at what stage in time. I'm really grateful for your time.
It's a pleasure, Nana.
Thank you. So that has been Health Check today. We were discussing jaundice in children. So if there's anything you are not sure about, go to your medical practitioner, and I'm sure they'll be able to help you out. My name has been and always will be Nanama Anobempong. Thank you very much for watching. See you again next time.